Good afternoon, everybody. So, Chairman, it's a pleasure to be here, and I see also well-known and famous people right in the chair, and also in the audience, and it's a pleasure to speak about bioregenerative PRP and other analogous therapy, our results, and a look into the future. So, the OA therapy is well known, steroids and most popular are at the actual time hyaluronic acid and PRP analoga. Mesenchymal stem cells are also in discussion. I personally don't use them, but the other two I use very often, nearly day by day. So PRP is said is working with the growth factors and healing factors. They are listed here. Also, it is a great proliferation and differentiation on the stem cells, and also on the collagen production, the angiogenesis, and an anti-inflammatory cytokine effect. So a lot of publications have been done in the last year, and the number is growing year by year, as you can see in all the topics we are interested. So this year in April at the ASCA 20th Congress in Paris, the first consensus conference was done under the name Orbit. And Orbit is dealing with the most important people who are dealing in the field of regenerative techniques, especially PRP. So these are one of the important publications. This is one also from the Italian group, OA disease modifying effects. So on the clinical way, they saw 80% positive effects, and the disease modifying chapter 68% positive effects. I think this is very good. So when we compare that, PRP versus placebo and steroids, then we see also a very, very positive effect on the long term of the PRP, and this offers an improved clinical and functional benefit over the 12 months. I speak a little different about a special kind of PRP, platelet-rich plasma, that is induced by gold. And this was investigated by Ulrich Schneider in Germany, and I show you here two kind of columns. The blue columns are the factor of the growth factors from the early childhood, as we have that as adults. And after gold-induced cytokine therapy, we have the red columns. That means a high increase of very important growth factors from the early childhood with a lot of power, biological power of regenerative effects. So this is one publication. I was also connected with Ulrich Schneider and some others. And this is our laboratory for gold-induced cytokine therapy. So the blood cells or the blood is given with the gold inside a incubation period for 24 hours. And then we do a centrifugation from out of that, getting the plasma without the blood cells, and then we have the gold-induced cytokine. And only to remember, tendon regeneration is very slowly. This is only to show you where we come from, and we are speaking right now about one case, and I show you not numbers, I show you cases, clinical cases, and what we found in individual follow-ups. So this is a rupture of the Achilles tendon. A young guy of 45 years old. We injected 4 syringes week after week, every syringe with 3.5 millimeters about of the plasma parallel to the tendon, not inside the tendon. It doesn't matter. And after 6 weeks, we saw a picture that you see in the center. And usually you have a picture of that after half a year or a year. This is not regularly after 6 weeks. And this guy was playing in that moment football again, where he ruptured his Achilles tendon. And after 1 year, we saw that. You don't see anything about the rupture, no scarf tissue. This is a complete restitutio ad integrum, as we say in the Latin world. That means it's working great. And this is one of the pictures of platelet-rich plasma with a gold-induced cytokine. So another guy, 55 years old, long tile, nearly 2 meters, a horizontal rupture of the medial meniscus. You can do a resection, but then you lose a very important rest of the bone. And when you have a look here, there is an individual separation of the cartilage right here, also some defects area in the weight-bearing zone. And then we did the same therapy with 4 injections week by week, 4 weeks of the PRP. And then we saw after 18 months a picture of that. I think it is a miracle what's happening right here. So the meniscus is rebuilt again, and you don't see any defect of the cartilage right here on that area as well as here. So now we go ahead. I told you in this morning about the 3rd generation of healing response, and we also use here the gold-induced cytokine therapy to give the healing process a better circumstance, a better healing for the reinsertion on the proximal ultrafemoral rupture of this ligament here. So this is a picture with the MRI of a young guy of that. This is the rupture and the instability with the small rest of the ACL. You don't see anything here inside the MRI. And when we follow that, and we have a follow-up of 9 to 24 months, you see a complete restitution, and it's getting better and better, and the fibers are nearly that of the original of the ACL. So another example, on the same patient, we had a problem also on the meniscus. We had to take out a part of the meniscus, but we had left a rest of a horizontal lesion, and this was performed better and better over the time. Next is a case also with a healing response right here. A young policeman was running right here. This is the intra-arthroscopic picture, and these are the pictures after the 13 months. So another topic, shoulder. So we also treat a lot of shoulders. This is an incomplete rotator cuff lesion of a lady of nearly 70, and we did not do a surgery. We gave the injections with gold-induced cytokines, and then you see after 6 months, a result of that, she was pain-free, and the range of movement was free. So another guy, 62 years, 10 years of pain, and we saw that. It is really not so nice to make a surgery on that, and we decided to use it and try it with the gold-induced cytokine therapy. After 9 months, I had to ask him, please go to the MRI. We want to show the people how it works. I want to see what's going on when you are so satisfied and you have no pain. And what we saw is that. This is a reorganization and reconstruction of the rotator cuff by itself. Nature is our friend. So another case of an osteochondritis. Here, a big defect of 3 centimeters. We make a macrofracture taking out the loose body, and then we saw first 4 months after the surgery and given the injection with the gold-induced cytokines, and that was here. And 8 months and 21 months after that, we saw a better consolidation step by step. So this is a young patient, a football player as well, German football, with a situation of a cartilage defect after a luxation of the patella, and we treated him also with a gold-induced cytokine therapy, and you saw it was a very nice reorganization of the patella and was playing with football at that time. This is a special case. So this morning we discussed also the treatment of young patients. This is a 14 years old young football player, and he has had a trauma, a complete anterior cruciate ligament rupture. And you see that here. This is the MRI with an instability of 12.3 millimeters. And this is really a heart instability. We measure all of them. Then we had to make a decision. Do we do a healing response in this age? Possible, but we decided with the parents to use the gold-induced cytokine therapy. And after 10 weeks, we had a result of that. It was similar in the stability, but that here was shown on the MRI, and we have also here a restitutio ad interim. It is a miracle. Unbelievable. So it's also published by Ulrich Schneider and Bill Morell and others, and also Nicola Mafulli. And this is showing how it works. So once more, these columns, remember the big column here is that after the gold-induced cytokine management, and this is also the curve we have when we are 2 to 3 years old. That means when you come as an adult, we can bring out of your plasma the power of a 2 to 3 year old person at that time. So, which is the right scope we use? Good or bad PRP? No one knows really. What is bad PRP, leukocytes or not leukocytes? No one really knows. But the growth factors have one advantage. They are individual without any side effects, and they seem a high biological power. We are searching in one cases for that. But today, what we know with the tool gold-induced cytokine therapy, it seems to increase this power. It is a better stimulation of the biological systems. It optimizes the input for stem cells, and it's also supporting a very important thing that means autophagy. And autophagy supports also the clinical cleanup, and it's working antiviral. So Goldic is a product, a medical product type 2B. It is on the market since 2018. It is certified and has a CE mark approval, and also it's working antiviral, influenza, HIV, hepatitis, herpes, and COVID-19. This is very important. So to remember, these are the factors that are upregulated by gold and its influence during the incubation phase of 24 hours. And take a look on that very important area here, macrophagy, inflammatory proteins, and they are very helpful and necessary for that biological cleanup. And to give you an impression what that means, so the mitochondrions lose their competence over the years, and they also can make a lot of problems. And here a lysosome progress is working in that, and this is making the clean up inside the cell. It's called autophagy. So this is also one picture for a mitochondrium in an autophagous process. So present and future. So one of the biggest problems we have in the world is the COVID-19, and also a post-COVID syndrome. And everywhere in the world it's a big problem, and making a lot of costs to treat. And the next one is a post-COVID vaccination syndrome. And no one is speaking so much about, but we have the cases. I show you one case and the next. So what is happening there with all our diseases, also on brain, there is an acclinating defect proteins, and they are that unusable cell structures. and therefore we need that cell cleaning effect I showed you before. This is a young patient. Georgia is her name, 34 years old, very, very active. No, please take out that.
تكنيكال سبورت عاوزين ندي تايم شوي.
So I hope it works right now. So, and now you see what happens with that lady. She has had a vaccination with BioNTech Pfizer. After the second vaccination, she had the problem like that. This is a Guillain-Barré syndrome, and it is not an actor, is really true. She's very, very sick. A patient in the United Kingdom. In her normal life, she was very active, organizes Elton John concert, and look at this. No one knows why it works at that. Then she was investigated on all the sites, and no one could help. And then they started, the colleagues in London, with a Goldic injection, intravenous therapy, 2 injections, and you see what happens after the first and after the second injection intravenously. So this is a miracle by itself. So I think it works on that way. Taking out and clean up of the macrophagy, and this is only describing that what is happening in the background. But Goldic, it's working very nice. It is a modulation out with gold on the normal PRP. It's a PRP analogous therapy, stimulating of the biological systems as possible, and it optimizes the input for stem cells, regenerative and reparative, active autophagy support, and also antivirus. Thank you for your attention.